My name is Miranda. If you have acute back pain, I would suggest you do my video, S.O.S Back Pain, first of all. This video is to take you on further. So when you're ready for a bit more movement, when you're not actually in acute pain now, maybe there's a sort of dull ache, or maybe you're just in remission from your back pain at the moment. So to help stretch and strengthen all the muscles that can cause back pain. So many people think they just got to strengthen their tummy muscles, but that's such a small part of it. We really need to strengthen abdominal muscles, the deep abdominal muscles, not just the superficial ones, our back muscles. We need to stretch and strengthen the hip flexors, the muscles on the front of the hip, and pelvic floor, so much more. So all around the core, the whole of the core. So this video is going to aim at stretching and strengthening all the muscles that might cause your back pain and help prevent it. What you would benefit from is a sock or pair of socks, a belt or dog lead or dressing gown lead, anything you've got available, and a rolled up blanket. So I've got a rolled up blanket here ready. So rolled up in a long lengthened way, or a big towel. So what we're going to do is we're going to start off lying on the blanket. So if you roll it up fairly firmly, and lie on it so that your bottom is on the blanket, as well as your head. So if you don't have a blanket that's long enough, you may need to have something separately underneath your head. Make sure that your neck and your head feel comfortable. You may need to put something extra underneath your head. If you have a position where your head comes forwards a bit more, give yourself the support. Don't be somewhere that feels uncomfortable here. Settle onto the rolled up blanket, and you may feel gradually that you're ready to move on to something firmer, so you can get half rollers that are really perfect for this too. So you take your arms out by your sides, so your elbows are bent, palms facing up, if this feels okay for you. If this feels too strong for you, then just have your arms away from your body and palms facing up or further away. So just being where you feel a bit of a stretch around the front of the chest, so the pectoral muscles really helping to straighten your back. And stay here. So you should be somewhere. You get a bit of a stretch in the front of the pectoral muscles, front of the shoulder. Legs bent, feet on the floor, just making sure that your legs are in a comfortable position. Close your eyes and breathe. And the breath is a really powerful tool when it comes to pain. And often stress is a big cause of back pain. So if you breathe in a way that puts your body into a stressed position, fight, flight, it will really aggravate pain. So we're going to focus first of all on the breath. So as you inhale, draw your breath down into your belly. Feel your belly swelling on the inhale and falling on the exhale. Long deep breath. So each inhale, draw it down into your belly. Feel your belly swelling on the inhale and falling on the exhale. And breathing through the nose, so close your mouth. It's a much calmer breath through the nose, much healthier breath in so many ways. And I have lots of videos on the breath, on breathing, how to breathe in a healthy way if you feel that you would benefit from this. So just taking a moment to really deepen the breath and allow your body to settle, to release here. And you may feel your back just softening, releasing around the blanket. Muscles that are tight, just letting go. Just a few more breaths here. And then if you roll off the blanket and take it away and come onto your back on the floor and bring your knees in towards your chest and hug your knees and rock from side to side, just giving your back a nice massage here and just observing how as you bring your knees in towards your chest and you rock from side to side, your tummy muscles are just engaging just a little to stop yourself from tipping over. It's a massage in the back, abdominal muscles engaging, waking up. Then bring your hands onto your knees and take your knees a little bit further away. Inhale. Exhale, bring your knees in close. Inhale, take your knees away so your arms straighten. Exhale, bring your knees in close. Inhale, straighten. And keep going. And as you exhale, you should feel your tummy muscles engaging. So as your tummy muscles engage, your back releases. Inhale, arms away. Keep going. And anything we do, only go where it feels good for you. If something doesn't feel good for you, do less. Or skip that exercise and move on. And that doesn't mean don't ever do that exercise. It just means for now, while that is causing you pain. So don't go to where you experience more pain, where it's aggravated. The next time you bring your knees in towards your chest, catch hold around the shins, drawing your legs in. If you can clasp your hands together, wonderful. You might not be able to reach. And just stay here and breathe. And again, breathing through the nose. Breathing in and down into your belly. So you can feel how on every exhale, your back just releases a little bit more. Because the more you exhale, the more your tummy muscles are engaging. So again, there's that opposing group of muscles. Tummy muscles engage, back muscles release. And then bring your left foot onto the floor. With your hand on your right knee, circle your right knee. And that circle might be quite small, or it might just gradually get bigger. And you might feel that there's more movement there. A lot of back pain comes from prolonged sitting. Many of us sit far too much, sitting at a desk, sitting at a table, sitting in a car. There's so many causes of back pain, but sitting is a very big one. So it's bringing more movement to our hips. And take the circle in the other direction. So our hips get so tight from lots of sitting. And the pelvic floor too. This really wakes up the pelvic floor muscles. A very big part of our core. Notice too how the tummy muscles are just gently working. And again, your back is just getting a gentle massage too. Then bring that foot onto the floor. And change legs. So again, circling. So starting off small, exploring with it. Don't go suddenly into big movements. Move in an exploratory way with your body. Seeing where you can go, what feels good. And don't go somewhere that doesn't feel good. Just gradually letting the circles get bigger, if that feels okay for you. And then take the circle in the other direction. And then bring the foot back down. And bring your right knee in towards your chest. Catch hold around the shin. Draw the knee in. And then straighten your left leg slowly along the floor. Just making sure that feels okay for you. Just taking it slowly. And reach away with your left foot. And press down with your thigh. And as you do that, you may feel a stretch in the front of your left hip. And these muscles here in the front of the hip, again, can be a very big cause of back pain. So push away with your left foot as you draw your right knee in. Taking some deep breaths here. So just allowing your body to settle here. Deep breaths. So again, exhaling more. We're going to keep the thigh in close to the chest, but we're going to catch hold behind the thigh. So hands around behind your thigh. And we're going to stretch the hamstrings, another big cause of back pain. Tight hamstrings. So when you're ready to, inhale, take your right foot up towards the ceiling to where you feel a stretch. It's not about trying to straighten the leg, it's about the stretch. Exhale, bring the foot back down. So keeping your thigh close in towards your chest. Inhale, take the foot up to where you feel a stretch in the back of the thigh. And exhale, bring the foot back down. And a few more times, just observing how that feels for you. So not trying to be anywhere, just making sure that it feels good, it feels right. And the next time you come up, stay there and reach your way with your heel and point your foot. Reach your way with the heel and point. Reach your way with the heel and point. And then we're going to find the belt. So if you take the belt or lead, whatever it is you have, even a long sock can work. But if you take the belt over your foot, and this time come into a straighter leg, and you may find, if your hamstrings are very tight, that you really have not got a very straight leg. You might find that your leg is further away from you. So again, it's about the stretch. Find a place where you feel the stretch in the bulk of your thigh, making sure it's not behind the knees. If it's behind the knee, just soften the knee. And draw the leg in towards you. Make sure that you can see the inside of your heel, just making sure that your leg is in the correct position. The knee is pointing forwards rather than turning in. Make sure your shoulders are away from your ears. Keep pushing away with your left foot. Keep pressing down with your left thigh. And breathe deeply. Again, if you're happy to close your eyes, close your eyes. It's much easier to really notice what's going on in our bodies with our eyes closed, rather than being distracted by what's going on around us. Long, deep breaths, and using those exhales to encourage the muscles in the back of your leg to let go. The hamstrings get tight from so many things, from stress, from sitting, from running, from bicycling, a lot of things where we can end up with very tight hamstrings which will aggravate your back. And this is the safest way to stretch your hamstrings, lying on your back where your back is nice and straight. And then take the belt away and bring that foot onto the floor. And change legs. Bring your left knee in, catch hold around the shin rather. And slowly straighten your right leg along the floor. And push away with your right foot and press down with your thigh. Snuggling that left knee in towards you. And again, just making sure the shoulders are away from your ears. So making sure that your neck is nice and relaxed. And breathe deeply. Really reaching away with that right foot. So again, you're getting a stretch in the front of your right hip. And that might be a big stretch for you. It might just be a little mild stretch there. Long, deep breaths. And then again, we're going to keep that thigh close in, but we're going to catch hold behind the thigh. Inhale, take your foot up to the ceiling, up to where you feel a stretch in the back of the thigh. And exhale, let the foot come back down. Inhale, take your foot up to where you feel a stretch in the back of the thigh. And exhale, take the foot back down. And again, keep going for a few more times. So just observing how that feels. When you take it up this time, keep it there. Reach your way with your heel, you'll feel that stretch even more. And point your foot. Reach your way with the heel. And point. Reach your way with the heel. And point. And then if you find the belt again, and take it over your foot. And again, just come to a place where you feel your shoulders are relaxed. Again, you're feeling it in the bulk of the thigh, not behind the knee, so soften the knee if you're getting it there. And again, just finding that place where works for you. You may be there, you may be closer. I'm quite flexible here. So just where it works for you. And again, make sure that you can see the inside of your heel, so your knee's not turning in. Breathe. Use the breath again, long deep breaths. Deep inhale through the nose. And exhaling again through the nose. Breathing through the nose as much as possible, always. It's a much calmer, healthier breath. In my other videos, I really talk about the benefits of the breathing and the ways I suggest that you breathe. Just long, deep breaths, using those exhales again, particularly. You feel your body releasing, particularly on those exhales. And take the belt away. And put it off to one side. And bring both your knees in towards your chest. And hug and rock from side to side. Give your back a nice massage. And then bring your feet onto the floor. And this is where we're going to find the pair of socks. So if you take your socks and just put them underneath your lower back. Settling them, snuggling them underneath your lower back. And we're going to do pelvic tilts, first of all with the sock, the pair of socks, and then without, if that feels okay. So arms by your sides, hands by your sides. Inhale. Exhale, tip your pelvis back and press your lower back down into the socks. Inhale, tip your pelvis forwards. Exhale, tip your pelvis back and press your lower back down into the socks. Inhale, forwards. And keep going. So notice now as you press your lower back down into the socks, you'll feel your tummy muscles engaging. Squeeze your pelvic floor too. Inhale to relax. So here we're really waking up the core muscles, the tummy muscles, and the pelvic floor muscles on the exhale. It's when they should naturally engage, but we can lose that if we get stressed and we breathe in and up. Exhaling, pelvic floor muscles engage, tummy muscles engage. Inhale, they relax. So each time your tummy muscles engage, remember that's really helping your back muscles to let go. Now you may feel that you can have more movement here. So if you feel happy to take the socks away, take them away, and then you can just find, you can tip your pelvis back further. Inhale, pelvis tips forwards. Exhaling, tip your pelvis back, lower back presses down to the floor, squeeze your pelvic floor. Inhale, pelvis tips forwards. So just noticing that you can tip your pelvis back further. So this is more movement as long as that feels okay in your back. But keep the socks if that feels better for you. And then we're going to move into a bridge position. So we're going to bring more movement to the back, but only go up as high as your back feels happy to come. So inhale, exhale, tip your pelvis back again, but this time move on further. Press each vertebra into the floor and gradually lift it up off the floor, one vertebra at a time, just coming up to where your body feels happy to be. Inhale there. Exhale, roll slowly back down again, one vertebra at a time to come back down again, bringing movement, freedom to your spine. One vertebra at a time, as much as possible to come back down again. Inhale, a resting breath in, or maybe you're happy to tip your pelvis forwards. Exhale again, tip your pelvis back, and again roll up into bridge position. Moving one vertebra at a time, as much as possible to come up onto your shoulders, or wherever you get to. And you may not come as high, you may feel you can come up higher. Your body, your breath, moving on the exhales. So listen to your body. You may find that there's a place where you're very clunky and several vertebrae move together. That's normal.
Just see if you can get as much independence of movement between all the vertebrae as possible. So just coming up to where your body feels happy to be. You'll feel bottom muscles are working here too. When our glutes are strong, it really helps to stop those front of the hip muscles from tipping the pelvis forwards when they're short and tight. It brings balance to the pelvis. Staying down this time, so when you come down this time, stay. We're going to come up into bridge again, but with the arms. We're going to stretch the lats here. So when you're ready to, inhale, take your arms up towards the ceiling and over towards the floor beyond your head. Exhale, when you're ready to, bring your arms up to the ceiling and back down by your sides. Inhale again, arms up towards the ceiling, over towards the floor beyond your head. And exhale, back up towards the ceiling, back down by your sides. The next time we're going to introduce the bridge again. So inhale, arms up towards the ceiling and over towards the floor beyond your head. Exhale, peel your spine up again, coming up onto your shoulders, coming up into bridge, just to where your body feels happy. Inhale, reach and stretch with your hands as if you're trying to touch the wall behind you. Your hands might not reach the floor. Exhale, when you're ready to, roll back down again, away from those hands. One vertebra at a time again, as much as possible, moving slowly, moving mindfully. Inhale at the bottom. And exhale, tip your pelvis back, roll up into bridge again. One vertebra at a time, as much as possible. Inhale, reach and stretch your arms as if you're trying to stretch and touch the wall. Exhaling, roll back down again. Again, one vertebra, as much as possible at a time. And one more time in your own breath, so just moving on the exhales. Keeping the breath slow and the movement slow. And when you come down this time, stay down and just observe that stretch. From the fingertips all the way down the arms and down through the torso too. And then release out of that stretch. And bring your knees in towards your chest and hug. And rock from side to side. Then bring your feet back down onto the floor. Hip distance apart. If you're happy to, take your hands behind your head, clasping your hands together behind your head with your elbows out. If that feels uncomfortable, have your arms just away from your body, palms facing up. So having your hands wherever feels good for you. We're just going to do some gentle twists here. And our spine particularly really likes to do back bends, forward bends, side bends and twists. We don't do enough of these movements. So inhale. Exhale, take your knees over to the left a little bit. Just see how that feels. Inhale, back to center. Exhale, take your knees over to the right a bit. Again, just observe, how does that feel? Just check that you're within your comfort zone. Inhale, back to center. Exhaling over, and maybe you can move a little bit further over. Inhale, back to center. Exhaling over to the other side. Inhale to center. And just moving slowly, again, with the breath. And just maybe seeing if you go further each time. But maybe the movement is really small. So this is something that you can really gradually build up with. Don't feel you have to be anywhere. It's just about bringing movement to your body. So the obliques, the second layer of abdominal muscles. One side is stretching, one side's working. So you may feel this engagement again in the core, and a gentle stretch. You may feel you can go further over, taking the knees further. Just moving in a way that feels good and feels right for you. Just gradually bringing more movement to your body. And this might not mean today, it might mean after practicing a little bit more. You may feel that you would like more movement, but your legs are a bit restricted by your feet being hip distance apart. You might feel if you take your feet a bit wider, that you can go further. And taking the knees a little bit further over. And as you take the knees further over, you'll feel a little bit more of a stretch in the front of the hip and in the side of the waist. So it just becomes gradually a bigger stretch, a bigger side bend, so a bigger twist. You might feel as you go over that you can reach your way and down with the top knee. So as you go to the left, the right knee reaches away and down. And you come back on the inhale. As you go to the right, you may feel the left knee can go away and down, reaching a little bit more. Coming back up. And then making that the last time. Again, bring your knees in towards your chest and hug. And rock from side to side. And then bring the feet back down off the floor. We're going to wake up the deep abdominals. And it's very easy for people to think that they have got strong abdominals, so they should be fine. But quite often it's the superficial tummy muscles that are strong, and they completely neglect the deeper ones, which are our stabilizing muscles. So we're going to wake up the deepest tummy muscles. Hands on your hips. So the hands are just going to observe what's happening here. Inhale. Exhale, from the inside, attempt to draw your hip bones towards each other. So it's like a shortening, narrowing between the hip bones. Inhale, relax. Exhale from the inside, attempt to draw your hip bones towards each other. You should feel your belly flattening. Inhale, relax. And keep going. And if this image of hip bones drawing together doesn't really work for you, visualize that you've got a corset being tightened around your middle on the exhale. So the inhale, it's relaxing. Exhale, hip bones towards each other, or that corset being tightened. And that should be an instruction to the same muscles. But the effect should be that you feel the belly flattening. Hip bones don't really move very much. It's minimal. So a few more times, just really feeling that waking up of the deep abdominals. And as long as you feel that there is a flattening, if you feel something happening, if you don't feel anything happening here, then stick with this. Don't move on to the next stage yet. But if you do feel that flattening of the tummy and the deep abdominal engagement, then feel free to move to this, where we're going to take a foot off the floor. So when you exhale, hip bones towards each other, belly flattens, lift your right foot off the floor just a little bit. Inhale, bring your foot back down. Exhale, hip bones towards each other, lift your left foot off the floor. Inhale, back down. Exhaling, keep going, belly flattens. Make sure your belly flattens. Inhale, take the foot down, keep going. Again, make sure you're breathing through the nose. And this again really encourages that flattening of the belly, the engagement of the belly on the exhale. So if you're a chest breather, this might be more unusual for you. But it's really important for our backs to be healthy, to have this exhaling, belly engages, tummy muscles engage. Inhale, they relax. And then both feet down. Stay there for a moment. Breathe deeply. And bring your knees in towards your chest again. Hug, just to stretch out the back. And release again. Then bring your feet onto the floor again. But this time if you have your hands on your hip bones, so again, the hands are again just going to be observing, they're not doing anything. We're going to use the muscles on the side of the waist, the QL muscles, and these muscles too, we can have big imbalance in them, tightness and weakness. So inhale, exhale, draw your right hip up towards your armpit, so your bottom stays flat on the ground, but you shorten the right side of your waist. Inhale, back to neutral. Exhale, draw your left hip towards your left armpit. Inhale, back to neutral. So you're sliding your pelvis sideways. Exhale, right hip to right armpit. It's a bit like you're pulling a toggle and shortening the right side of your waist. Inhale to neutral. Exhale, left hip to armpit. Inhale to neutral. Keep going. So again, just make this movement as big as feels good for you. If it causes you pain, avoid it. Skip to the next. It really helps to free up the pelvis, strengthening these muscles and stretching them on either side of the waist. And then come to neutral. And having worked them, we're going to come into a bigger stretch. So straighten your legs and take your right elbow up beyond your head. So the hand just resting, upper arm just resting behind your head or above your head. And then inhale, reach with your right elbow and your right heel, lengthen. Exhale, relax. Inhale again, right heel, right elbow, lengthen, reach, and exhale, relax. And a few more times, just really feel the length from the elbow to the heel, lengthening the whole of the side, and relax. And again, reach and stretch, and relax. And then we're going to change sides. So take your left arm, just comfortably resting, elbow bent, hand beyond your head. Inhaling to take the left elbow and heel away from each other to lengthen. And your exhale, you relax. So again, keep going with your own breath. Feeling that length along the left side. Each time you're inhaling, you're stretching. And then take both arms over beyond your head. We're going to come into a side bend. So if you take your legs over to the left, just to where you feel happy to take them. And then take your arms over to the left too, and your upper body moving over to the left too. So you're coming into what's a bit like a banana shape. So you're stretching out the whole of the right side of your body. Don't roll over onto your side. Keep your shoulders both on the floor, both hips on the floor. The whole of your back is on the floor, and you're stretching out the right side. If you can, don't have your arm over beyond your face. Arms as much as possible down. And breathe. Feel the stretch on the right side of your body. And breathe into it. Use the breath again. Take your inhale all the way down to your right hip. Move it all the way up to your armpit. And exhale fully. So each inhale, take it all the way down to your right hip. All the way up to your armpit. Long, full exhales. You may feel after a little while that you can take the legs over a little bit further. You may feel you can catch hold of your right wrist and give that arm a little bit of a pull if that feels good. Just increases the stretch a little bit more, but don't be again where it's going to be aggravating pain. Just be where you feel a good stretch. And then come back to center. Just settle for a moment. And then take your legs off the other side. And your arms over. Just settling. So again, just finding that place where you feel a good stretch along the left side of your body. whole of the back of your body is on the floor, including your shoulders and your hips. Breathe. Take your inhale all the way down to your left hip, all the way up to your armpit. And exhale fully. Deep breaths. And again, you may feel, having settled here, there's a little bit more freedom to take the legs further, and that's only if it feels good. You may well feel a big stretch along the left side of your hip particularly. You may feel you want to catch hold of your left wrist and give that arm a bit of a pull. That increases the stretch up around the arm and the shoulder. But only where it feels good, breathe. Using those deep breaths. And then come back to center. And again, bring your knees in towards your chest. So bring your feet in first if that feels more comfortable, and knees in. Then we're going to roll over onto our bellies. So you want to have your blanket near for this one. And for this one, you will want to have the blanket in a different position. So you want to have it folded up like that. So have that near you, just so you can bring it closer. Use it if you need it. And come onto your front. And make a pillow with your hands resting underneath your head. And just take a moment here, lying on your front. And then we're going to use our glutes to release the front of the hip muscles. So inhale. Exhale, squeeze your buttocks. Inhale, relax. Exhale, squeeze your buttocks. Notice how when you squeeze your buttocks, the front of the hip moves closer towards the floor. Inhale, relax. Exhale, squeeze your buttocks. Inhale, relax. One more time, squeeze your buttocks. Inhale, relax. And then we're going to strengthen the back of the legs, bottom muscles and lower back a little here, which also releases front of hip muscles a little bit more. Inhale, raise your right leg up. Exhale down. Inhale, left leg up. Exhale down. Inhale, right leg. Exhale down. Inhale, left leg. Exhale down. And then come up onto your elbows. Now here we're stretching the front of our body, and quite often when we overwork our tummy muscles, we can really, and also when we slump, we become very short and tight in the front of the body, which can really cause our back pains. So we're settling here. Now you may feel, if you feel compression in your lower back, don't go there. You may feel more comfortable to have your elbows further forwards, so it's less of a back bend, less of a stretch. Or you may feel, this is where the blanket can come in really useful, that if you put your blanket underneath your pelvis, so it just tips your pelvis, so it tips your pelvis forwards, no backwards, the other way around. So just have it so that it's supporting, so your legs are going down behind you and the pelvis is just tipped backwards a little bit, releasing that movement in the lower back. Just finding the place where you feel like gives you a bit of support. Just a bit of lift for the pelvis. And settle. Staying here. Breathing deeply. You may feel you don't need the blanket. If you feel you don't need it, don't have it, take it away. That is just if you feel you need the pelvis to be tipped back. Otherwise, if your pelvis tips forwards in your day-to-day life, if you stand with the pelvis tipped forwards, overarching your lower back, you'll be doing the same thing here and your lower back won't like it. So just avoiding that. Breathe. Settle into this back bend. Look at your breastbone heading forwards. Take your shoulders down. Breastbone forwards. Engaging those muscles in the back.
Breathing. So again, using the breaths to encourage your body to settle here. So it's a back bend without too much effort here, but we can add a little bit of extra effort. Inhale. Exhale, press down into your forearms and attempt to drag your elbows back. And that's only if your lower back doesn't say here. Just adding a little bit of extra effort to the upper back. Exhale, attempt to drag your elbows back. Inhale, relax. One more time. If that feels okay, just as long as it's not aggravating your back, press down. And come down onto your belly. And bring your hands underneath your shoulders. Elbows in, shoulders away from your ears. We're going to come into Cobra, so back bend here. But don't push yourself up. Use your back muscles to come up, and don't come up too high. If you come up too high, you'll find you're just using your hands. It's a big back bend, but you're not working your back muscles. So inhale, lift up. And the lower back bend is actually working the lower back muscles more. Exhale, come back down. Inhale, open up. Lifting up. Just coming to where feels right for you. Exhale, come back down. And remember that blanket. If you feel any compression in your lower back, put the back blanket underneath you just to tip your pelvis back a little bit. Your inhale, come up. Exhaling down. And then when you come down this time, we're going to move the back bend into a different part of our back. So if you take your arms out by your sides, it's going to shuffle up, I've got not much space to my right. So arms out by your sides, palms facing down, and reach your arms away from you and take them up off the floor. And inhale, come up again, reach those hands away. Exhale, come back down. Inhale, arms up. Reach those hands out, beyond you, away from you. Exhale, come back down. One more time. Inhale, come up. Arms reach away. Exhale, come down. Make a pillow with your hands. And turn your toes towards each other for a moment. And wiggle your bottom. Shake your bottom out. It's a lovely release for the lower back to be doing this. And then one more area of strengthening for the mid-back. So you take your arms down by your sides, palms facing down, and take your hands up off the floor and reach them towards the back wall. On an inhale, head and chest up. Exhale, come down. Again, hands up off the floor, reach them towards the back wall, head and chest up. Exhaling down. One more time, if that feels okay, but stop if it feels it's enough. Hands reach back, head and chest up, and come down. And then roll over onto your back. And bring your knees in towards your chest, and hug, and again rock from side to side. Going to finish off with a twist. So if you straighten your left leg and bring your foot onto your right foot onto your left knee, just shuffle your bottom over to the right just a little bit. Take your right arm out the side with your palm facing up, and take your knee, your right knee, over to the left. And so your right hip comes up off the floor. Your left hand can come to rest on that knee, on that thigh. So just encouraging the thigh to come over, and just observe how that feels for you. So you may feel you can go further over, but you may feel that you've just gone a little way here. So just come to where you feel. So the hip comes up off the floor, you come into a twist, and just explore how far does your body happily go over. You may feel happy to turn your head to the right, so your neck is following the same line of the twist. Getting a bit of a stretch there too.
And breathe. Think about again taking your inhale down into your right hip, all the way up to your armpit. And exhale fully. As you exhale, you may feel a sense of release, that thigh going over just a little bit more. Only stay as long as feels right for you too. If you feel you need to come out of it sooner, then do. Sometimes there's a sense of click, click, click as things fall back into place. Breathing. Close your eyes maybe if that feels good so you can listen to your body and make sure you're not neglecting something that doesn't actually feel good. And just gradually you may find you can come further over into this twist. And again, gradually doesn't necessarily mean today, just maybe after practicing this position a bit, becoming more flexible and strong. And then come back to center. Foot back on the floor and the other foot, shuffle your bottom back to the middle. And then straighten your right leg. Left foot to rest on the knee. Shuffle your bottom over to the left a little bit. Left arm this time is out by your side with the palm facing up. So you're getting a stretch in the pectoral muscles again here. And then the right hand can be on the thigh. And take the knee over to the right. So again, your hip comes up off the floor. Just moving to where it feels right for you. So it just might be a little way. It might be further. Turn your head, if you're happy to, off to the left this time. And again, breathe. Use the breath. So take your inhale all the way down to your left hip. All the way up to your armpit. And exhale fully. Long, deep breaths. And again, see you can feel how as you exhale, you might release a little bit further. But again, make sure that you are only going as far as your body is happy to go. It might just be a little twist, a gentle twist, and that's all that's right for you today. And come back to center. Bring the foot back onto the floor, the other foot back onto the floor. Shuffle your bottom back to the middle and bring your knees back in towards your chest. And again, hug. Such a simple movement, but so beneficial. And then bring your feet onto the floor. We need to finish off in a straight line. If that feels okay for you, so straighten your legs. And take your arms away from your body and your palms facing up. And it is great to remind our bodies what a straight line is. It's very easy for us to tip forwards at the hip, to overarch the back, head come forwards, shoulders come forwards. So just settling here. If you feel really uncomfortable, put your blanket underneath the knees. If you're feeling discomfort in the back, put something underneath your knees just to soften if your hamstrings are very tight. Breathe, close your eyes. And again, observe the breath. So draw your breath down into your belly. Feel your belly swelling on the inhale and falling on the exhale. Just taking a moment to really allow your body to soften, to let go after making this effort that you've been doing, this work you've been doing for your back. Really allow the breath to lengthen. Exhale more. So remembering that exhale is where we let go. Allow a pause after each inhalation and after each exhalation. And really allow those pauses to lengthen too. Really allowing the breath to be leisurely. Deep breaths. And this long breath, leisurely breath, is really important too to help release stress. So if stress might potentially be causing your back problems, really focus on the breath, and I would suggest using one of my videos for the breath on how to breathe. And then we're going to bring the knees in. Hug your knees again and rock from side to side. And feet back on the floor. Roll over onto one side. It's a much easier way to get up, especially if you have a bad back. Use your hands to push yourself up, to come to sitting. And do try and work out what might be causing your back pain. If it's your bed is too soft, your bed is too hard. If it's too much sitting, stand up. Notice if your pelvis is tipping forwards, if that is it, you're overarching your lower back. And it'd be nice to stand against a wall sometimes to feel that, to find out what is happening there. Hamstrings, but so many things. But I hope that this is helpful for you.